Good morning. Thank you for joining us today for a news conference with speakers from UAB and the Jefferson County Department of Health. Speakers today will include Sarah Nafziger, co-director of UAB's Emergency Management Committee, Mark Wilson, Jefferson County Health Officer, and Selwyn Vickers, Dean of UAB's School of Medicine. We will let each guest speak and then do a reverse Q&A to minimize close contact and walking back and forth. As they will share, we are in a very dire situation. Cases are spiking at an alarming rate, and they correlate back to Thanksgiving exactly 2 weeks ago. Christmas is exactly 2 weeks from today. All will explain what we can do to stop cases from spiraling even further. As a reminder, please download the GuideSafe exposure notification application so you are aware if you have had an exposure with an infected person. With that, I will welcome Dr. Sarah Nafziger.
Good morning. Thank you for joining us today. I'm going to start by bringing you some very concerning updates. Our hospital inpatient numbers of COVID-19 patients has continued to rise over the last few weeks. This morning we have 159 COVID-19 patients in our hospital, and that is a significant increase. Because of this, we have curtailed services at UAB by reducing the number of surgeries and procedures that we can schedule that require an inpatient bed. These reductions were implemented earlier this week in order for us to preserve capacity to care for COVID patients and to continue to be available for emergencies. Of course, that's one of our primary objectives, is to make sure that we're available for emergencies when people present to us and need our services. This is something we're continuously reassessing. And just this morning, a large group of physician and nursing leaders met, and we made some very difficult decisions about further drastically reducing the number of elective surgeries and procedures requiring an inpatient bed scheduled for next week. What that means is that patients who have serious medical conditions may have to wait to have their important elective medical procedures performed. And all this is because of the rapid rise in the number of patients requiring care for COVID-19 who are filling our hospital beds right now. None of us are happy about this. We've been in constant contact with other hospitals in our area, and all of them have reported that they're in similar circumstances. We're all working together to continue to support the medical needs of our communities and make sure that we can meet our patients' needs and most importantly, care for those emergency conditions. I'd like to emphasize that we're not in normal operations mode right now. We know that these increased caseloads of COVID-19 patients are going to hinder our operations further. Over the last 2 weeks, let me be clear, our COVID patient admissions have doubled at UAB. Most of these cases are attributable to travel and small gatherings. We're starting to see patients who acquired a COVID infection over Thanksgiving be admitted to the hospital. We reasonably expect, based on the numbers of new cases diagnosed every day over the last 2 weeks, that the rate of cases we see is going to double again over the next 2 weeks. So that means we expect a doubling by Christmas Day of the number of patients who are in our hospital being treated for COVID-19. So that was the bad news. I'm going to transition now to tell you the good news, because there's a little bit of a ray of hope to this story. COVID-19 vaccine, as you know, received an emergency use authorization approval from the FDA just yesterday. And UAB Hospital has been working with local and state public health officials on distribution plans for this COVID-19 vaccine. UAB was selected as one of the first sites in the state, and only in Jefferson County, to receive and distribute COVID-19 vaccine just as soon as it is available. This vaccine will be prioritized for healthcare workers in both the hospital and outpatient environments and for EMS providers. Now, UAB is sharing its vaccine allocation with all the hospitals in our service area, as well as with ambulatory providers and with Cooper Green and our federally qualified healthcare centers who provide desperately needed health care to our medically underserved populations. The vaccine will be provided free of charge. We anticipate the arrival of the first shipment sometime next week, and we'll begin distributing and administering those doses of vaccine just as soon as it becomes available to us. That's the great news. Now, the vaccine is not going to stop the surge that we're experiencing now. It won't be available in quantities sufficient enough for us to stop this surge right now. But it's a ray of hope, and it's something to help us begin to flatten the curve and hopefully prevent future surges like the one that we're experiencing now. I'd like to emphasize to you once again that UAB is still here to care for patients, particularly those having emergency conditions. While we're cautioning everyone to be careful, if you need emergency medical care, please still come to the hospital. It's still safe to come see us for treatment. The emergency departments are open. They're ready and willing to treat you. Our healthcare workers, they're definitely tired. We've had a lot of media attention about that. People have been talking about how healthcare workers are spread thin, and that's true. We've been at this for a long time battling this pandemic, and we're stretched thin right now. But I'd like to reassure you once more that we're always going to be here to care for you. And we hope that we're not put in a position in the coming weeks to have to curtail services further, because we want to be available for you when you need us. I'm going to close by asking you one simple thing. I'm going to ask you this. Treat everyone you know as if they have COVID-19. Wear your mask, socially distance, wash your hands, and be careful. We've got to stop this now before conditions get even worse than they are. Thank you very much.
Dr. Nafziger. So we're going to welcome Dr. Mark Wilson from the Jefferson County Department of Health up to speak.
Good afternoon. As was mentioned, the Jefferson County Health Department has been staying in close contact with Dr. Nafziger and UAB as the initial vaccine plans are being rolled out. We're also working closely with the Alabama Department of Health on the statewide plan overall. I would like to mention we just learned recently that the Veterans Administration Medical Center will be receiving a shipment of vaccines as well. That's really good news for our healthcare workers who are taking care of our veterans. Our health department will also be working with community partners throughout the vaccine rollout to make sure that all of our citizens of Jefferson County, all of our residents of Jefferson County have the information that they need about these vaccines. The initial Pfizer doses will go to our frontline hospital workers, which is very appropriate. Also our emergency medical services and a few of our healthcare settings in the ambulatory setting. I have to emphasize that these initial shipments are just a drop in the bucket, even for those workers. But the good news is we expect more vaccine to continue coming, and the Moderna vaccine, we hope, will be available in the near future. I want to take just a few moments to try to speak for some of the voices that we may not always hear about during the pandemic. Each and every day, the nurses, the maintenance crews, facility workers, doctors, lab techs, food service workers, and others are at our hospitals taking care of us. Whether it's a mother who has COVID-19 and can't breathe, a father who's having a heart attack, or a grandfather who's fallen at home and needs help, we all need our hospitals to see us through this time of need. Today, when the men and women of our hospitals are fighting hard to save lives, they're doing everything they possibly can to make sure every patient is delivered back to wellness. We want you to listen closely to the words of these leaders of our hospitals, not just those that are here today, but our other leaders like our CEOs, our medical staff leaders. They're worried. They're worried through the next few weeks they might not have a bed for someone who needs care. The men and women, these heroes who work in our hospitals, they're not quitters. It's not in their blood. They'll fight until they have nothing left. But there are only so many of them. There are only so many beds that they can staff. We may be approaching a time in the near future where that mother who can't breathe, that father having a heart attack, or that grandfather suffering a fall, maybe a broken hip, may not be able to receive the care that they so desperately need. This is a very real concern. In fact, it appears more likely than not. That is why I'm begging, pleading with each of you to help our nurses, maintenance crews, facility people, doctors, lab techs, and others at our hospitals. I'm begging you to help the mothers, the fathers, the grandfathers who may need care in a hospital. This year, that may be someone in your family. I want people to know how very well I understand the suffering caused by this pandemic. Our lives have been fundamentally disrupted. Many have been hospitalized. Way too many have died. Fundamental life events have been canceled. And nothing has been normal about this past year. We all miss seeing the people who are dearest to us. We're social creatures. Humans are not meant to live in isolation. We realize that. The difference now is that we do have a way out. There's hope through these vaccines, but we have to wait a little longer. By taking a few steps to prevent COVID-19, we can decrease hospitalizations. We can keep people alive until the vaccine is here, and we can help ourselves get out of this awful situation. So whether you're young or old, healthy or sick, this Christmas, please have a small gathering with just those people who live in your household. Try to use digital platforms and other means to communicate with those more distant relatives. Please try to avoid travel, and most importantly, avoid large gatherings. Holiday parties are just not a good idea right now. With our current level of disease activity, a gathering of just 20 people, there's more than a 50% chance that one person in that gathering will be infectious, contagious with COVID-19. Really, any situation where you are in close contact with anyone not in your household, where you're not wearing masks, it is inadvisable at this time. That would include sitting across the table from someone or standing close to someone while eating or drinking. If even a few large events occur without the strictest precautions, we will have more sick people than we have hospital beds or nurses or doctors to care for. So as a close, I want to make a plea to the community. We're in the holiday season. We understand that sacrifice is needed for success. This year, I ask that you help make just one more sacrifice. Please have a Christmas celebration with family just inside your household. Make this sacrifice so that our healthcare workers can safely do their jobs and take care of everyone who needs medical support. Remember, these men and women are going to be in these hospitals working on December 24th and December 25th, and we want to set them up for success and see us through to a much brighter 2021. Thank you.
Thank you, Dr. Wilson. Now we're going to welcome up Dr. Selwyn Vickers, who's the Dean of UAB's School of Medicine.
Good morning. You have heard really passion pleas from Dr. Nafziger and Dr. Wilson. I echo those because of the number of our faculty, our students, our fellows, our nursing faculty who are now being pulled to the front line to work extraordinary efforts. With that said, Dr. Nafziger made it very clear that there is a ray of hope, and as it relates to the vaccine. Most of us know that as it relates to the minority populations in our areas, two things are true. The history of our country and even our state as it relates to treating people of color has not been stellar. The Tuskegee syphilis study stands out as the paradigm shift of how people of color were treated in an inappropriate way when there was known therapy for syphilis. I would say that that gives some concern and justification for people who are worried about this vaccine. And even today, we still suffer from the health disparities that largely exist in people of color. It's been made very clear that although we live with these, this pandemic has linked a coronavirus infection with a chronic disease, with an individual living in a high-density area, having to use public transportation, being an essential worker, not having the ability to work remotely, with lethality. Those people often are managing their heart disease, they were managing their diabetes or their COPD. But because of that lack of care and access to care, this virus has made it very clear that those combinations are lethal. Now, with that backdrop, what should be the message to our minority communities? I think it first starts to understand that we're aware that we have a history that's tainted. Number two, it also is to remind us of the data. The data suggests that we have suffered inordinately, and we've died in significantly higher rates when we've gotten infected. So that this vaccine has showed a preferential desire to harm people of color because of all of those things we mentioned earlier. And when Dr. Nafziger said there was a ray of hope, we've heard that before. We've heard it with the drug remdesivir that it partly was developed here at UAB. We've heard it around dexamethasone, which is now clearly a therapy to help people who are on ventilators and are not well. We heard it inadvertently and inappropriately around other treatments that actually we thought would provide some benefit. But what I would mention, and the final thing we've heard it in the context, and what I was referring to was hydrochloroquine, but the other thing we've heard it in the context of is the monoclonal antibody therapy, which has made a difference for people when they've gotten treatment early enough. All of those things, particularly those antibodies, are in some limited supply. But none of them have ever purported an efficacy over 90%. Nor remdesivir, nor the monoclonal antibody therapy, or anything we have to treat this virus has come close to thinking of those numbers. So to say that the vaccine studies exceeded our expectations may be an understatement. The timing to get this to people was quite quick, but it was not due to shortcuts. It was due to next generation molecular biology that allowed us, within a week after the virus was defined, the sequence of the virus was shared by the Chinese government, and days after that, a vaccine model was put in the animals. And as soon as the evidence showed its benefit in animals, it was moved to humans, and those trials often take years to accumulate people. And the development of a putative vaccine often took years to do before, not because of shortcuts did we get there quicker, it's because the techniques and the advance of medicine allowed that to occur. Typically, the enrollment in trials of 30,000 people for other illnesses have taken 1 to 2 years. And in this case, it's taken only 2 to 3 months because of the urgency around this pandemic. So we've now seen the data very clearly. African Americans, Latinos have all been included in significant numbers, and the data is profound. So as it becomes available for the general public, I would encourage you to get in line, be first in line to get this vaccine. We've seen the benefit of 1 and 2 doses make a huge difference in the populations that have had it. I'm encouraged by what I see. I'm terribly encouraged by the approval of the FDA. I would be most delighted if people of color in the minority community and everybody actually lined up and demonstrated that as Americans and as Alabamians and citizens of Jefferson County, we recognize that this is what can change the course of events for our community. Finally, Dr. Wilson has pointed out, and Dr. Nafziger have made it very clear of the unprecedented times and the efforts that our frontline workers are putting forward to take care of your loved ones. Be mindful of the requests that have been put out. Stay safe in regards to wearing your mask and the gatherings. We ask that you do that to support not only us, but to support you and your loved ones who may need care and those who we're caring for now. Thank you.
We're going to keep Dr. Vickers up to start the Q&A portion. If anybody has questions specifically for Dr. Vickers, feel free to either raise your hand or comment. This can be for both Dr. Vickers and Dr. Nafziger, so I'll ask it twice. From WBHM, can you address the state of morale or the general mental health of medical staff at UAB and what's being done to address that unique mental health need of medical staff at this time?
So we have an active wellness program, both to allow our staff to have access to opportunities for support. I think we communicate on a regular basis to have them understand that we recognize the sacrifices that they're making. And we're trying to support many venues of their world in order for them to continually work at their best effort in doing so. But I would say the biggest thing we do is that we are aware of the mental as well as the stress that is provided, and we're trying to make sure we support them through all the services throughout the hospital to recognize their sacrifice.
Thank you. Tyler Patchen from the Birmingham Business Journal asks, what will be the process or strategy to get the vaccine to historically underserved populations in Jefferson County and Birmingham? I'll also ask this of Dr. Wilson.
So fortunately, the NIH and the federal government have provided a significant amount of resources for us to begin building trust and communication strategies throughout the minority communities. So that process has started and will continually go forward to answer questions, to have trusted leaders speak to them about the vaccine, and have trusted leaders demonstrate, hopefully, taking the vaccine. So there will be an organized and focused approach to communicate with the people, the communities of color and minority communities, in order to build those bridges that have not existed in some degrees as it relates to healthcare about getting the vaccine. So there will be a broad level of campaign and efforts to get this to them.
Thank you. All right, Alan Collins with Fox 6, feel free to ask your question.
Dr. Vickers, as we understand, healthcare workers will be among the first to get the vaccine soonest next week. Is the issue of minority, will they be included on that list? Is there a section to be sure that minorities are included in healthcare workers who are be getting that first vaccine next week?
Yeah, and I'll let Dr. Nafziger comment. I don't think that Phase 1A includes an exclusion or inclusion of specific minority communities. Obviously, those healthcare workers who are minority will be included in this distribution. The priority this time is just for healthcare workers broadly, not for any specific community.
Thank you, Alan. Brian Pia with ABC 3340, feel free to ask your question.
Yes, this question is for anyone who's reporting on this thing. Can you explain how the healthcare rollout is going to work, and basically, how do you get as many healthcare workers vaccinated as quickly as possible?
Hey, Brian, we're going to table that question for Dr. Nafziger because she'll be able to explain specifically what we're going to do here at UAB. So if you don't mind, I will come back to you for that question. If you have a follow-up, anything else, feel free to ask it now. But I will get that to Dr. Nafziger. Kim Chandler with the Associated Press, feel free to ask your question. Kim, are you there?
I apologize, I did not unmute myself.
You're fine.
This may be for Dr. Nafziger as well. There was a projection, cases have doubled since Thanksgiving, and I believe she mentioned a projection that cases may double again by Christmas or around Christmas. Can someone discuss what that's based off of, and what will be the impact on non-emergency services and other procedures provided by UAB if that happens?
Yeah, let's come back to Dr. Nafziger on that one. If you don't mind, I'll come back to you. One last question for Dr. Vickers, and then we'll continue to move on. We have gotten a few emailed questions about efficacy and safety of the vaccine in other populations like pregnant and nursing women? Maybe there's some other immunocompromised populations. Can you just express or explain what that data looks like now, Dr. Vickers, and what we could anticipate in the future?
Yeah, the initial approach for the vaccine study was really to take all comers, even people who had been infected before, and it took a few pregnant women and had a reasonable number of women of childbearing age. So the numbers, particularly around pregnant women, aren't significant. They're small right now in this study. From what we see, it was safe, but the numbers are too small to speak very clear about it. I think as it relates to the broader population, as it relates to these other illnesses, immunocompromised, all of those seem to be relatively safe in the spite of what people may think. There didn't seem to be a great number of adverse reactions. There were a couple of people in the UK who had some anaphylaxis, but they had a history of having it. And so there are people who can get a shot of saline and also have some issues related to just the shot alone. But in the broadest terms, the vaccine seems to be very safe.
Another follow-up question, two more for you, is what if, somebody asked, what if I get the Pfizer vaccine and my friend gets the Moderna vaccine that may be approved in the near future as well? Can you talk about why we have different vaccine candidates right now and what that might look like as we have more options available?
Yeah, I would say in general, you're both fortunate and have done the right thing. They're both mRNA vaccines. The data early on for both, clearly the publicly viewed data for Pfizer looks very good. And the Moderna, in some ways, may even be better, certainly as it relates to handling it is, but we'll know more about the specifics. But we have multiple candidates in order to make sure we had the best opportunity to get a viable vaccine. And these two certainly have, I think in many ways, as I said, exceeded our expectations. Moderna seems to be no less. So if you got either one of those two, you're in good stead.
And one last question for you from Henry with Yellowhammer News. Henry, feel free to ask your question. Henry, are you there? I don't think he is coming through. If you just want to message your question in the chat, Henry, that would be great. Thank you, Dr. Vickers. I think that was fantastic information. Let's have Dr. Nafziger come up because we did get a few specific questions for you, and I'd love to get those addressed. Give us 1 minute. So we will circle back to Brian from ABC 3340 and then Kim Chandler from the Associated Press. So Brian, feel free to ask your question.
Yes, Dr. Nafziger. Could you explain how the rollout to healthcare workers is actually going to work, and what's the plan in place so that you get as many healthcare workers at UAB vaccinated as quickly as possible? What's that going to look like?
So thanks for asking. You know, rolling out a vaccine program with over 10,000 doses of vaccine is not a simple task. You know, at UAB, we have employee health services that's accustomed to doing an annual flu shot vaccination campaign where we vaccinate around 14,000 people over 6 weeks. And we're used to doing that, so we know how to vaccinate a lot of people quickly. Undertaking this vaccination campaign is a little different, and it's a lot more challenging. There are several reasons for that. First of all, Dr. Vickers mentioned the storage requirements. This Pfizer vaccine product does require storage at ultra low temperatures, which is minus 80 degrees Celsius. So if you're storing a vaccine that cold, it requires very special freezers that you can't just go to the store and get very easily. So those are things that we had to make sure were in place so that we could be approved to receive the vaccine in the first place. Once we receive the vaccine, we have to maintain that storage, maintain the temperatures, monitor that, and document it. So there's a lot that goes on behind the scenes to make sure that we keep it safe and ready to deliver so that it still works by the time people receive it. After that, the vaccine comes to us in a little vial as a powder, and we have to dilute the powder so that we can get it in a liquid suspension and prepare it for administration. So as you can imagine, there are also a lot of steps involved in that. So taking vaccine from the freezer to a syringe to inject in someone's arm is a lengthy process. There are a lot of details involved, so as you can imagine, it's quite complex. In addition to that, this vaccine requires 2 doses, not just one, like our annual flu shot booster. Everybody's going to have 2 doses of this vaccine. For the Pfizer product, they're separated 21 to 28 days apart. For the Moderna product, we understand that that will likely be 28 days apart. So we're planning for that and trying to schedule doing this twice for every individual who's vaccinated. Now, once again, UAB is accustomed to providing flu shots for our own employees every year, but this vaccine distribution is different because we're going to be providing vaccine not only for our own employees, but for employees of other hospitals, of other ambulatory centers, and for EMS providers in the 7-county region. So as you can imagine, it's a little complicated. Because of this, we're setting up 2 vaccination locations. One will be exclusively for our own employees on our own campus, for ease and convenience of our own employees to receive their vaccine. The second location will be the drive-through site at our Highlands campus parking deck, where we normally have operations in the morning for people to drive through and receive a COVID-19 test, a nasal swab, so that they can be tested for COVID-19. In the afternoons, we're going to convert that parking deck to a vaccination administration site, and we'll have folks come through there so they can drive through and receive their vaccine. We want to make it as easy as possible for the healthcare workers who are selected to drive through and receive their vaccine in an easy and timely manner. Now, all of this is going to be by appointment only. I know a lot of healthcare providers in our area have been reaching out to try to ask how they can get an appointment to come get their vaccine. Well, the shorter answer is we're going to contact you. We're going through the leaders in each of these healthcare organizations and asking them to help us identify, using specific criteria, which healthcare workers they will send first to be vaccinated. Now, we can't just send all the healthcare workers at one time because, that would overwhelm the system. So we're doing this by an appointment basis, and they'll be given an appointed time to come receive their vaccine. One final thing that I'll comment on before I stop talking about this is that the vaccine does have some mild side effects, just like any other vaccine that you receive. And so it's recommended that we don't vaccinate the staff of an entire area all on the same day, just in case people have some of these mild side effects that were described, such as headache and soreness in their arm, even mild fever. We want to make sure that, we give everybody the opportunity to recover from those side effects, even though they have been described as mild. We want to make sure that we give them a chance to recover from that, so we're not vaccinating an entire unit at once. So as you can see, there are just a lot of logistical details that go into this. At UAB, we're fortunate that we do have a lot of personnel available. As Dr. Vickers mentioned, folks have been coming out of the administrative side of the house to assist us. And then our colleagues on campus, particularly from the School of Nursing, have stepped up to help us in this vaccine administration campaign. In addition, the other hospitals in town have offered staff to come help us with vaccine administration. Some of those details are still being worked out right now. But we're very grateful to have the partners that we have on our UAB campus to help us achieve this task that we've been entrusted to do.
Thank you. That was a very comprehensive overview. We have a lot of questions for you. So going to come back to Kim with the Associated Press. Feel free to ask your question, Kim.
Hi, thank you, Doctor. Thank you for doing this. You had said that UAB had approximately doubled its census, I believe, in the last 2 weeks since Thanksgiving, and there were concerns that we could double again. Could you discuss the time frame for that and what that projection is based off of, and what if that happens, what would be the impact on non-emergency services at UAB?
So unfortunately, as we've learned throughout this pandemic, none of us can tell the future with great precision. As we learned early in the pandemic, a lot of epidemiologic forecasts and projections have been made, and a lot of them were accurate and a lot of them were not. Fortunately, we've learned a lot since that time, and some of our faculty here at UAB in the School of Public Health have been very helpful to us in developing models to forecast what our caseloads might be like. So we have some actually very refined models that help us predict what the hospitalization rates might be and how many cases we can expect to be in our hospital at any given time. Now, the limitation of these models is they really can only predict accurately out for 2 weeks at a time. And so that's why a lot of our planning is based on 2-week intervals of time. We plan for what we're going to think happens in the next 2 weeks. In addition to that, those projections that we receive from our faculty in the School of Public Health, we've also just been looking at our actual census numbers, and we've seen those numbers continue to climb. Our cases have increased in the hospital at a rate of 5.5% per day over the last 2 weeks. Considering the number of new cases in the community that have been diagnosed every day, we anticipate that that will continue at least over the next 2 weeks. Now, what will it look like beyond those next 2 weeks? I don't know, because we don't know how many new cases are going to be diagnosed over the next week. But what we know right now with fairly certain terms is that the next 2 weeks we're likely to see a doubling of cases at UAB Hospital. Now, what does that mean how does that impact our operations? We have a very specific surge plan, and let me tell you, surge planning is complicated. It takes up a lot of time for a lot of people. I meet multiple times a day with leaders from hospital nursing, from our Center for Patient Flow, from our physician leadership, our administrative teams, and we work together to tweak our surge plan on a daily basis. We look at where patients need to go, where they need to be placed, and there are a lot of things that go into that. We have to look at airflow and air handling and nurse staffing models and the needs of our patients, because ultimately that's what it's really all about. So once we kind of bring all those things together, we modify our surge plan based on the anticipated needs, and we designate units where we think we're going to go next when we have the next COVID patients who arrive to our facility. And what that means for us is incrementally, we designate more and more nursing units to care of COVID patients. So instead of caring for the patient population they normally would have, those become designated as COVID units, and they receive COVID positive patients instead. The patients who would normally go to those units then become displaced, and we have to put them on other nursing units to provide their care. So as you can imagine, a place that has well over 1,100 staffed hospital beds, that's quite complicated.
Thank you for that. Several questions. Melissa Brown from the Montgomery Advertiser asks, can you speak to who at UAB was responsible for determining the prioritization of who will get that first dose of the vaccine? And then in that first phase, is there some non-medical staff that's included, for example, environmental service staff in a COVID unit? Can you just give a little bit more of that breakdown of who may get this outside of what qualifies as a frontline worker?
So first of all, when we were selected by ADPH to receive COVID-19 vaccine, they had some very specific parameters about the categories of healthcare workers that they want us to administer vaccine to. So they gave us some details about percentages to go to hospital-based employees, to ambulatory-based employees, to EMS providers, and to the other hospitals in our service area. So first of all, that was guided in broad strokes by Alabama Department of Public Health. So to be more specific, we did have had at UAB a multidisciplinary group of physician leaders, nurse leaders, infectious diseases experts, and infection prevention experts who have all come together to look at our allocation and decide which employees should be targeted to receive vaccine first. Now, these are going to be, just like we've been instructed from Alabama Department of Public Health, these will be our frontline healthcare workers who are caring for COVID patients. It's going to be people who are essential to delivery of that care. So absolutely, yes, that's not just doctors and nurses. There are a lot of people who provide care to our patients. There's environmental services workers, there's food and nutrition workers, there are respiratory therapists, physical therapists. There are lots of different disciplines. I know I probably shouldn't have started naming them because I'm sure I left somebody out. But there are lots of different groups of people who provide care to our patients. Our objective is to cover all of them so that we can make sure that we can deliver safe care to our patients. We don't want to leave any group out.
Thank you. Can you just give an update on the ICU bed situation? You did touch on surge planning, but just kind of what the situation does look like now, what we're looking towards the next few weeks.
You know, at UAB Hospital, our critical care beds are always full. You know, a lot of people have asked me, oh, are you panicked because your beds are, you know, greater than 90% full? And my answer is no, that number alone doesn't make me concerned because our ICU beds are almost always greater than 90% full. Our resources are in demand. We have a lot of patients who need the services that we provide. The concerning thing is that at this point in time, a significant chunk of our ICU beds are filled with COVID patients rather than the patients who would normally be in those beds. This morning, I believe that last I heard is a third of the COVID patient population at UAB is requiring critical care services. So that's a lot of people. We're continuing to reassess this, as I've mentioned over and over. I can't state enough how much work is going into micromanaging each individual bed to make sure that we maximize our capacity to care for patients. So as more and more patients present requiring care, we are converting more and more ICU beds from non-COVID care to COVID care. Is that putting a strain on our critical care resources? Absolutely, yes, it is. There's just no way to sugarcoat that. We have quite a demand for our services right now, and we're, every bed is being utilized as possible.
And I'll just add before I take the question from Tyler Patchen with the BBJ, we've stated this for many months, but it's not always just a literal bed. It's the staff that goes into caring, ancillary staff. There's a lot that goes into what a bed number looks like. So when we're asked directly about, ICU bed capacity, there are a lot of people behind the scenes too, which I know we've stated. Dr. Vickers mentioned too, we are pulling in other hands from other parts of campus. Tyler Patchen with the BBJ, feel free to ask your question.
Thank you very much. Dr. Knapziger, what sort of elective surgeries and supplementary surgeries are being curtailed and possibly delayed at UAB? And for how long do you think this will last for? What are your estimations?
So, elective surgeries at UAB don't look like a lot of people might think when they think of elective surgeries. These are not surgeries that are cosmetic in nature or things that you could do without. A lot of them are quite essential. In fact, essential is the term used to describe most of these procedures that are being delayed. We do have a multidisciplinary group of surgeons who are reviewing these cases and the cases that need to be scheduled. And they're looking at them and making a determination about which cases to continue with and which cases to delay. And they're basing that on the patients. They're looking at the patient's condition and trying to prioritize all the cases that really need to go first for the patient's needs. Things that can wait, where the patient might be okay if they can delay a week or two, those are the type of cases that are being delayed. So it's not a simple decision. I'll tell you that our physicians are not happy making those decisions, but we're trying to make sure that the things that we delay are things that can be safely delayed. That's our number one priority. Now, how long will they be delayed? Well, that's hard to predict. It depends on the demand for services. It depends on how far this surge continues, how high are we going to go, how long is it going to last. And like I mentioned, we can predict fairly accurately out for about 2 weeks, but beyond that, it's fuzzy science, and I don't want to comment on fuzzy science. I want to speak about things that we know fairly certainly.
Thanks, Tyler. Jen Horton with WSFA, feel free to ask your question.
Thank you so much. I have a question that's more general about the vaccine. We're beginning to see some information come out about what may happen if people don't follow up with that second dose. Some of the estimations are a bit grim. If you know, what could you tell us to expect for the population that you all know generally does not return for follow-ups, that may not return for that second shot, and what it could mean for all of us in terms of the vaccine and the virus spreading in our community?
Well, we don't have a lot of information about that right now, but what I can tell you with certainty is that we know that if a person receives even one dose of this vaccine, then that does provide some protection from COVID-19. They're much less likely to contract the disease. The second thing that we know with certainty is if they receive that one dose of vaccine, they're much less likely to have serious complications from disease. So even one dose is helpful. Now, what's even better than that is getting that second dose, because once you get that second dose, it's going to be greater than 95% effective in preventing you from catching COVID-19. So that's what we really want people to do. Now, at our vaccination site, one of the strategies we have to get people in for that second dose is, first of all, we're collecting their information so that we can remind them via text, via electronic messaging, via phone call, so we can let them know, hey, you got an appointment coming up, you need to make it for the appointment. The second thing is when we make their appointment for their first dose, we're going ahead and making the appointment for the second dose so that they have it made and they don't have to go through any other steps to get that second appointment. So to summarize, yes, we hope people do get both doses, but if they only get one dose, that's better than nothing. We're going to be happy about that, but we hope they get both.
All right, we've got two other questions with hands raised for Dr. Nafziger. If I have not asked your question from the chat, I'm going to ask that from Dr. Wilson. So I see them all. I will ask that of Dr. Wilson to kind of give Dr. Nafziger a break as well. So we will follow, we'll do Alan Collins from Fox 6 and Brian with ABC 3340 for Dr. Nafziger, and then we'll move on to Dr. Wilson. So Alan, ask your question.
Dr. Nafziger, you mentioned earlier, UAB is set to get 10,000 doses. How many will be going to UAB and how many will be going to area hospitals? Are you talking about just Jefferson County hospitals, or will you be going over to nearby counties also? And is it understand the delivery schedule, you'll be getting Pfizer once a week from now on, and then once Moderna is on, is that going to be once a week deliveries?
So the first part of your question, how many doses specifically will be held at UAB? I don't have those numbers right in front of me, but I can tell you in broad terms how these allocation numbers were decided between UAB and the other hospitals. The other hospitals that we're sharing with are all the hospitals in our service area, which is defined as a 40-mile radius. So that defines the listing of hospitals that we are sharing with. We made the decision to try to be the most fair and equitable to share with all these hospitals in the most generous way in interpretation of the ADPH guidance that we received. So what we did is looked at the number of staffed beds in each of those facilities and divided doses up based on that for the hospitals that are in the other category. Additionally, we decided that the allocation that was designated specifically only for UAB hospital, we felt that would be more fair to share that with other hospitals. So we did decide to share that specific subset of the vaccine with all the hospitals in our alliance partnership that includes the St. Vincent's Ascension hospitals in the area as well as Medical West. So we wanted to make sure that we were being equitable in our distribution so that we covered as many frontline healthcare workers as possible. And I'm sorry, I forgot the second part of your question.
Alan, was there a second part of your question?
Delivery schedule. We've been told that Pfizer might be doing weekly deliveries. You'll be getting from them, and then once Moderna's comes on board, will that be a weekly delivery of those vaccines?
So I wish I knew a great answer to that, but I don't know for sure. What I've been told preliminarily is that we can place an order on a weekly basis, and we anticipate the earliest arrival to be possibly on the 16th of next week, but we don't know that for sure. So that's the best information I have right now. I anticipate that could change because, as the state health department is giving us information as they receive it, they're at the mercy of the CDC, and everybody's at the mercy of the manufacturers and the FDA. So as we receive all this information, certainly we'll be sharing it.
Thanks, Alan. Brian, with ABC 3340, we'll take your question and then we'll move on to Dr. Wilson.
Yes. One question: has community spread of COVID caused a staffing shortage at UAB? And if so, how much will this Pfizer vaccine help with you have enough staff to deal with the current and future surge?
So our staff has definitely been impacted by COVID-19 infections. Our staff is just like everybody else. We have families, we have children, we have parents. We have to go to the grocery store. We live outside of work. So our staff has definitely been impacted by community spread. We've had significant numbers of staff who are infected at any given time. However, that's not impacted our operations. We've been able to compensate for that. We've been able to flex staff from other areas and accommodate those shortages. So yes, it's impacted our staffing, but it's not compromised our ability to deliver care at this point. Now, if it gets a lot worse, is that something I'm concerned about? Yes, absolutely. That is why we are so very grateful to have been selected to receive vaccine allocation and to get that out as quickly as possible, not only to our employees, but also to other frontline healthcare workers. So, we all share the burden of caring for COVID patients, so we're in this together. So definitely very happy to receive it. We have the total allocation for week 1 is, as I mentioned, 10,725 doses. So once we spread that out among all the different places we're giving it, that is only going to cover a small fraction of our employees. We hope as in the subsequent weeks, as we receive more and more vaccine, that we'll be able to cover all of them, but it's going to take some time for us to get that accomplished. So until we get that done, our employees are not going to have complete immunity to COVID-19 and our staffing can still be affected by the disease. So it's going to take some time for us to really see the huge benefits of the vaccinations.
Thanks, Brian, and thank you, Dr. Nafziger, for your time and expertise answering these questions. We'll welcome Dr. Wilson up to take questions, and then we'll close from there. And just a reminder, too, while we wait for Dr. Wilson, lots of great questions, more answers to come in the coming weeks, so we will try as best we can to continue to provide experts for you all. Please just be patient with us. Dr. Wilson, several questions for you. Let me go back to the chat. Apologies. We've had several people ask, if you get the vaccine, can you go back to pre-pandemic life? Do you need to wear a mask? Do you need to social distance? What does that look like once you are vaccinated?
Yeah, that's a really good question. I think it's one that we're still grappling with and will be as we get closer to that time. It does take a while for the vaccine to reach its full effectiveness. Your immune system has to have time to respond. But I think the big question is going to be, when do we or the state lift some of the mask restrictions, things like that. And I honestly can't answer that question right now because it's just going to be the kind of thing where we have to sort of see how things go. I think we would definitely want to get to a level where we actually see the results in our community numbers, where our transmission rate is significantly down, the number of cases per day is getting really low before we feel comfortable with that. But it's going to be a little bit tricky, sorting through all of that.
Another question is, if you have already had the virus, should you be vaccinated? That will affect a lot of people.
Yeah, I think early on, if somebody has had the virus, that it would be presumed that they have some immunity. Now, we know that immunity can wear off. There are more and more case reports of people that have gotten a second infection. But I think when we're in these early phases where there's a limited supply and there are a lot of people who have not had COVID or maybe don't, or at least don't know that they have it, it would make sense for those that have not had the disease, documented disease, be first in line and maybe wait for to get the vaccine later. But there's no reason for someone who's had COVID-19 not to get the vaccine, and it would be prudent at some point to get vaccinated to help extend that immunity out further. We still don't know as much as we would like to know about how long the immunity lasts from the vaccine itself. How often, and people might need to get a booster shot or things like that. That's information that is still to be determined.
Another vaccine question, and then I have a few more in your wheelhouse of the county health department. Once someone gets the second dose, are they automatically protected? We know that when you get the first dose, there's partial protection, but that second dose, you're good from then on?
Yeah, that's we've seen the efficacy data that's come out with Moderna, Pfizer, and with the AstraZeneca Oxford vaccine, at least some preliminary data with a 2-dose regimen, efficacy of greater than 90%, maybe 95%. So, that's not 100%, but it's, as has been stated before, that is nothing short of miraculous that the results are that good. But again, how long that immunity will last, at what rate will it wane, those are questions that will be answered as the FDA and others who are looking at these vaccines continue to track the data.
From the Birmingham Business Journal, how will the vaccine affect local businesses, and what's the process for getting businesses and employees the vaccine? We've talked a lot about frontline healthcare workers, but the community at large. Yeah, this is where people are going to have to be patient. There is a rollout phase schedule. I shouldn't say schedule, but phases, because we don't know the exact timing. We can really only make guesstimates at this point. But there's a phase 1A, which we're about to enter, which is those frontline healthcare workers, the emergency medical services people, and a separate shipment that will be going through a separate means to our long-term care facilities. And then there's a 1B that will go to some of the people that have a lot of risk factors and are older, other first responders, people that are in congregate living situations or working in those situations, like our homeless shelters, the people that work day in and day out in our jails, just as examples. Those are people that are at high risk of having an outbreak that we don't want to happen. And then there'll be a next tier. Let me just say, I think we're going to be into January just getting those first ones vaccinated. But then we'll be looking towards other folks that, still people that are at risk because of some sort of risk factor they have. Some other essential workers, like our school teachers, our police officers, others like that are going to be prioritized at a later time. That might be realistically February, March. And then just for the general population, which would include some of your people that work in businesses that don't have other risk factors, or maybe not in those businesses that are critical infrastructure for all of us. We don't know exactly how long it'll be, but I think our expectation should be that might be late spring or early summer. Thank you. That's a helpful timeline, and I know we are getting a lot of questions about that, so it helps put some perspective in reality. From Solomon Crenshaw with Birmingham Watch, are you planning another shutdown order that is stronger than what's in place for the state?
Currently, we're not planning any shutdown orders. We really don't want to have to do that. I would rather not be in a situation where it's, Jefferson County is doing something alone when we're part of a greater metropolitan area. So our hope right now, and as I said before, what we are pleading with the public to do is to help us by being extremely careful right now. I mentioned how we need to support our healthcare workers, support our own family members and loved ones by helping to protect them. But we do need to support our businesses. And the best way to do that is to be as safe as possible in all of your practices. I really don't want to be in that sort of terrible situation where we have to think about doing that again. So we just really, really need everybody's help right now. Now, in terms of restaurants, bars, places where you go in, we want people to wear a mask while they're in there as much as possible. So only take it off while you're eating or drinking. If you're just sitting around talking to people or something like that, put that mask back on, because that is a risky situation. And as I said earlier, I would think twice about sitting at a table or directly across from somebody who's not part of your household right now. If you're in an indoor setting, and even outdoors, if you're getting close with people, we still need to social distance. We need to wear masks, or one or the other. So really, really encourage people to support our restaurants. Do take out as much as you can if that's available. Let's try to support them how we can, but be careful about gathering with people not in your household one way or another.
All right, we're going to take two last questions for you, one from the Birmingham Business Journal and one from Birmingham Watch. So Tyler with the BBJ, feel free to ask your question.
Thank you very much. Dr. Wilson, specifically for businesses, what would be sort of the process or the thinking behind trying to get businesses or large corporations the vaccine, especially their employees? And is that even in the realm of possibility at the moment, or will that be a sort of a strategy later on?
That is a strategy that's being looked at for the really large businesses. We've preliminarily come up with a list of our very largest employers in Jefferson County that might be able to, if they're willing and can provide some of the necessary infrastructure, to potentially do a pod, where they can a mass vaccination for their own employees at the employment site. So that's something that we are looking at. Obviously you have to have the vaccinators, the people that can give the shots. So that is something we're looking at. There's going to be a window of time between this rollout through the hospitals that you've heard a lot about, directly to healthcare workers, and directly to our EMS providers and nursing homes. And then later in the spring, we're hoping to be where we're at the point where anybody can just go to their primary care provider or to a pharmacy and get a vaccine, just like you do your flu shot now. So that in-between time is what we're still looking at, and what role our health department or our partners might play in doing some sort of vaccination pods or mass vaccination locations, if you will, where people can come and line up and get vaccinated, either out in the public or in an individual business site.
Okay, and last question from Birmingham Watch. We've heard about plans to expand hospital beds for those with COVID. What are those plans, and with hospitalizations rising, how close are we to seeing those plans put in action?
So I think, as you heard from Dr. Nafziger, those plans have already been implemented to a large extent. Hospitals, are creating extra bed space, whether it be floor beds or ICU beds, to take care of more COVID patients. Those are beds that have to be handled a certain way as a COVID unit to avoid spreading to other people. So they've been reallocating resources to open up more beds. And as you've also heard, the main issue is staffing. That's the main limitation. We learned this back in the spring, at the beginning of the pandemic, when we got very concerned when we saw the hospital numbers suddenly start to shoot up. We were making plans to set up a field hospital. We're not really having active discussions about that right now, and one of the main reasons is extra beds, out in another location don't do you any good if you don't have the staff to staff them. So that's where we're really concerned right now.
Thank you, Dr. Wilson. Okay, we're going to conclude there. I appreciate everyone bearing with us. Lots of great questions. So Dr. Wilson, I'll conclude. All right, thank you all for joining us today. For the media on the line, a recording will be made available this afternoon, but please be patient with us while we upload this file. Please, again, a reminder to download the GuideSafe exposure notification application. It is a free application, so that you are aware if you have had an exposure to an infected person. You can learn more at guidesafe.org. Again, please continue to wear a mask, wash your hands, be diligent about social distancing, consider staying at home, and in protecting those you know and that you don't know. Thank you.